my name is Sakshi, and by now you all are very much familiar with the common and mild symptoms of COVID-19, which include fever, dry cough, sore throat, muscle cramps, and fatigue. But here it is important to know that there is more to just mild symptoms of COVID. Now, in some severe or rare cases, COVID-19 can also cause serious complications, including pneumonia. The COVID, which is known as the respiratory attacking virus, can damage your lungs to the highest level than you could ever think of. Now, in one such attack, one can cause fluid buildup inside the lungs, leading to pneumonia. Now, this particular type of pneumonia in COVID patients, which is caused by the COVID virus, is known as COVID pneumonia. Scary, right? Now, let us know from an expert about what is COVID pneumonia, what are the symptoms. Let us know about all these things in detail.
You see, COVID pneumonia is not a new thing. We have seen plenty of COVID pneumonia in the last 3 years, ever since the COVID started in March 2020. And COVID pneumonia is a simple pneumonia, but it is different from other pneumonias because it is very fulminating, and it usually chokes the patient. The patient's oxygen goes down. So we are not seeing many cases of COVID pneumonia now, but we are aware of it and we are quite apprehensive because the number of cases in India are rising now. Is almost more than 8,000 cases in last couple of days now. So we are quite cautious that we may see the cases of COVID pneumonia again. You see, COVID pneumonia is a fulminant variety, as I said. So when the patient gets fever and he gets cough and cold, he starts having breathlessness and he starts choking. That is the situation when we should suspect COVID pneumonia, and we should immediately get either a X-ray done or RT-PCR done, or now that we have a CT scan also, we should try to get a CT scan and try to confirm the diagnosis. And if particularly the patient is an elderly patient or some immune compromised patient, we should immediately try to get the patient hospitalized. As I already said, the biggest symptom is breathlessness and feeling of choking. The patient will say, "Doctor, as soon as the fever started, I have started choking." Choking means he'll have difficulty in breathing, and he'll be coughing very vigorously, as if he is feeling the choking feeling. So these are additional symptoms apart from high-grade fever, apart from cough and cold, apart from listlessness, apart from constitutional symptoms. These are the various symptoms that the patient may have. If the diagnosis is COVID pneumonia, first is to confirm it by a CT scan of chest, and then if it's positive, and if the patient is an elderly patient, the treatment is essentially patient has to be given the IV antibiotics, or patient has to be given some nebulizer drugs. So if the patient is serious, better be admitted in a hospital for giving all these treatments, because oxygen may be required anytime and patient may be gasping for breath anytime. So these three things: number 1, IV antibiotics; number 2, nebulization; and number 3, oxygen. And if the patient is serious enough, it preferably should be hospitalized.
Now, for more such health-related news, do log into our website, which is known as TheHealthSite.com. Also, don't forget to check out our YouTube channel.